Alright, imagine this. You're going to work, you're enjoying going on your daily life, even having a meal. But suddenly, you try to take a breath and it's actually difficult. You find there's tightness in your chest. Now, what are you going through? For most of us, these are the symptoms for asthma. Now, asthma has affected an estimated 2 million people in Malaysia, but only 6% of that 2 million have this disease under control. Now, in Health Matters today, we'll be exploring asthma and also talking to a doctor and also a patient about asthma and how to handle asthma. Now, a lot of us don't even know that this little guy can actually save your life. So join me in today's episode. This is Health Matters with me, Dishen Kumar. Let's start off with asthma. Everybody knows about it, everybody's heard about it, but what is actually, what consists in that disease when you're talking about asthma?
So it's quite complicated because it's something that, like you say, everyone has heard of, and even doctors, they come across asthma all the time. But to actually diagnose it is quite difficult sometimes because unlike things like hypertension or diabetes, you may have situations where you've got very fixed numbers, and if it goes above a certain number, you have a diagnosis. With asthma, it's very much a case of diagnosing through clinical features, so based on your symptoms. Typically, you get someone who has got an underlying problem with their lungs where there's a lot of inflammation, and because of that inflammation, you develop some form of sensitivity. So then you become a little bit more reactive to things that are inhaled, for example, allergens in the air, bad air quality, so tobacco smoke, diesel fumes, things like that. You may be more prone to some sort of reaction. And sometimes you can also find that there's a difference between the symptoms between daytime and nighttime. So when you get these kind of symptoms, then it tends to raise the question whether you may have asthma. So no simple answer as to what exactly it is, but the underlying theme is that there's inflammation in the airways, and as a result of that, you're more sensitive to things around you. So sometimes a prolonged cough, for example. So sometimes when you talk about asthma, you think of a kid who is wheezing. You may think of someone who's got some tightness to their chest. And some people have this myth that it cannot be diagnosed as an adult. So actually you can have asthma at any age. Typically you get it as children, but you can get it as an adult, and more recently we find that we actually have a large number or an increasing number of the elderly who also have asthma. So it can happen at any age. So that's one thing. And like I mentioned, like a chronic cough, for example, that can sometimes act as asthma as well. Now the flip side to that is sometimes asthma is overdiagnosed. So you hear someone with a wheeze or someone who has got some sort of tightness, and it could be other things. For example, if you've got tightness down here, then it could sometimes even be reflux because you've got acid going up, which causes some spasm. Sometimes it's actually issues with your nose where you've got stuff dripping down into your airways, and as a result of that, you have a prolonged cough. So once again, it's a bit complicated, and that's why having a good, clear history is very important. So what happens is, think of your lungs as consisting of various tubes. It's like a pipe, or rather various pipes. So the lining of the pipe becomes thickened. That's where the inflammation occurs. And if you imagine, if it becomes too thick, then it becomes more narrow. That's why sometimes you may find that it's a bit tight. It's like you can't expand fully. And sometimes when there's a lot of inflammation, it produces a lot of secretions. And that's why sometimes people can cough up phlegm, because you've got stuff coming up on the lungs. Now, alongside that, you may also find that the cough is there because you're reacting to things around you. So those are that's the process that tends to occur in order for you to get those symptoms. Now, if it's bad enough, then that narrowing becomes very, very tight, and you may find that actually you can't take a deep breath in. And at that stage, sometimes even taking your medication or inhalers won't help because everything is too congested. Then you rush in, you get admitted and things like that. So that's where things become very critical.
Now, talking about that inhalers, because you talked about if it gets very tight, you really can't use the inhaler. But how important is that to have by your side when you have an attack?
Very important. Now, in order to get to the point where it's so tight that even the inhalers don't work, there would have been preceding moments where you could have intervened. And inhalers, they generally fall into two categories. You've got what we call relievers. So inhalers that when you take it, you feel an immediate relief. It opens up your airways, but typically that lasts only maybe an hour or a couple of hours at most. And typically we find that most patients use something called salbutamol. So the blue inhaler, that's your reliever. Now there's a whole range of other inhalers that we label as either preventers or controllers. And as the name suggests, by using these regularly, it will control that inflammation. And not only does it mean you may have normal, straightforward quality of life, but it also prevents the inflammation from getting worse and prevents the asthma attacks that we're worried about. It's a spectrum. So you've got folks who have very straightforward asthma. You may have maybe an attack a year. Then in that sense, it may not actually be practical or even cost effective to actually use an inhaler every day. But I think carrying that blue inhaler, the reliever, around with you is very important, because you never know when you may react to something in the environment. So at the very least, carry that blue inhaler around with you. Of course, we've got people at the other end of the spectrum where things may not be very well controlled, and you may not need just one extra inhaler. You may need 2 or 3 inhalers, you may need certain types of tablets, you may need other types of medication on board. So that spectrum is quite wide, but at the very least you should carry a reliever around with you. I think that the basics remain the same. So at the very basic, the patient needs to take the inhaler regularly, but also correctly, because there are lots of types of inhalers out there. It's confusing as heck, and actually getting the medicine from the device into your lungs can be complicated. So the first and most important thing is using the right inhaler regularly, but also with the right technique. And we should spend lots of time actually talking about that when we meet our patients. Now, remember how I said asthma is like a spectrum? Now, in that spectrum, people may behave differently, and you may have different types of characteristics. So not all asthma is alike. And you may find that certain people will respond better to certain types of medication. So there are tablets and medication out there that work for certain groups of people. And as we learn more about asthma, as we learn more about these medications, we find that we can make things more personalized. So down the line, if things don't work despite the basic treatment, then there are various options. But these differ, and they are very much dependent on the individual. The goal of all asthma treatment should be normal quality of life. So there isn't really any excuse for people to not do what they are normally supposed to do. This applies for, once again, maybe about 95% of cases. So that very small number, of course, if it's too severe, then it's a different situation altogether. But if your asthma is limiting you and it's stopping you from doing things, then it means that it's not well controlled. So it goes back to, are you on the right medication? Are you using it correctly? And are you using it often enough? Once you've reached that goal of being normal, of being able to do things as any other human can, then we can then try and bring down the medication. So let's say you need 3 inhalers to get to this level. Once you're there, as time goes by, you may try to bring it down. So it's very fluid, very dynamic.